Welcome, everyone. We're very excited to have you here today to participate in the information session for Health Innovation Group and Health Innovation Action. My name's Eileen Patterson, and together with Arvel Ballon-Lyon, I'm co-founder with Health Innovation Group, which we started about 5 years ago based on what we saw as a gap in the system that we were committed to trying to serve and fill. We also have today with us the Medical Director of Health Innovation Group, Dr. Brad Baylor, who will also be presenting. And we are going to give you some information about some new opportunities, workshops, and training that we have experienced as being difference makers for those who are working in the field. And so we're excited to be launching those at this information session. You might be joining us here because of a role where you are also trying to support practice teams to have the best days that they can as they're working so very hard to serve the patients that they care for and experiencing some frustrations or troubles. And so you're just looking for what might be out there to be a better way. You might be here because you're looking for the latest information about supporting special populations, marginalized groups, those who require culturally appropriate trauma-informed care, and wanting to know what the latest evidence is around providing that care. You might be here because you are a manager seeking to retain and support the team that you have and deal with the burnout and stresses that people are having and see how you can alleviate that and provide a better system. So there are many reasons that people choose to learn more about how they can bring supports to the field, and we will be looking to address each of those with you today. So what we see is that there are common barriers that have existed for a long time within primary healthcare and primary care. Many of them are known issues that the system has been trying to deal with. And more recently, there are emerging issues that really need to be addressed that are providing incredible challenges to the providers and team members who are trying to do their work within the system, and they deserve the best supports available, and those supports are not always readily available. And so that's where we fit in, is making those supports more practical and bringing them to them with the goal of helping them to improve the patient experience within their practice, to have better health outcomes for the panel of population that they're serving, for improved care team experience so that everybody has a better day, and also to do it in a way that addresses health equity so that there is access to the right services in the right way for everybody. And overall, we know that when we do this, then there's a better system value. So it really is the win-win that we are supporting teams to address. Health Innovation Group is a social enterprise, meaning that the priority is to understand how Health Innovation Group can serve a greater social need. It's a service organization that's committed to filling gaps. And so with that, then we're also very principle-based in terms of addressing health equity. So rural, isolated populations and providers, the underserved groups are the ones that really are the where we focus our energies. We're looking for growth and innovation and seeking to make sure that we are serving in a better way all the time, and looking at the quality of care and the impact that we can have within the system. And ultimately, it is about joy and work for everybody in the system. And so really where we make sure to make things practical and fun and address the needs in a very human-centered way using the psychology of change. Health Innovation Action is the second group that we are introducing you to today. And that group is a not-for-profit organization which fosters partnerships and builds capacity for continuity to continuously improve health services across the system and health services across the neighborhood as well. So it is about capacity building and equity building as well. And it is a delivery partner to Health Innovation Group. So Health Innovation Group brings together the evidence and designs the content, and Health Innovation Action for those programs that are aligned to its mandate will be a not-for-profit delivery arm. So looking at that evidence, then we do know that there is clear evidence about what to change and how to change it. And that evidence is outlined through the patient's medical home. And so we're showing one of the many documents that are a guiding document for the evidence, which has been organized into the key areas that make a difference. So the evidence is a set of potentially better practices, is a set of the research, and then that needs to be contextualized, and we need to help to bring that evidence to life in the different environments, and that's the how. And so we know that we can improve the uptake of these better practices to improve the outcomes with the aid of practice facilitation. And so the uptake is threefold greater when you have a practice facilitator dedicated to supporting the team to plan and test and implement the changes, rather than asking them to do it off the side of their desk. So such an important role for health system transformation. And with that, I'm going to turn it over to Brad to talk to us about the programs that we have available now.
Thanks, Eileen, and thanks everyone for taking a bit of time this afternoon to join us. And I'm going to introduce 4 programs that Health Innovation Group has developed. Really developed to help support primary care practices deal with an ever increasing complexity, ever increasingly difficult environment, and really adapt to where family medicine is going. Each of these have been tested in provinces throughout Canada, and we're pleased now to translate them to a national audience starting in the fall. We'll talk a little bit about the programs individually. So the first 2 programs are delivered directly by Health Innovation Group. The first is the Patient's Health or Medical Home Expedition for primary healthcare teams. And so this is a immersive learning experience that will take place over a year. Clinic teams are navigated through really a comprehensive set of changes that are evidence-based that they can choose to implement and test in their own environments. Throughout the journey, the team members will be able to select strategies and customize those strategies to their own environment, as well as interact with peers throughout that year experience. The next is the Teams and Teamwork Learning Series. And so we know that there's an increasing focus on teams and teamwork in primary healthcare throughout Canada. And this is a deeper dive into the content outlined in the Expedition program, specifically working in optimizing team performance in each member's role in the team. Health Innovation Action will be the presenting partner for the other 2 programs, the first of which is the Practice Facilitation International Program. This is nationally accredited and is focused on building practice facilitation capacity for change in the primary care team environment. Impacts are sustainable, and Eileen talked about some of the benefits of practice facilitation in her introduction. The last of the programs, also delivered by Health Innovation Action, is the Person-Centered Interactions Learning Series. So like the Teams and Teamwork series, this is a deeper dive into the area of person-centered interactions, which again is an ever-increasing area of importance and really touches on things like trauma-informed care and culturally sensitive care for our Canadian populations. And this has also been tested and used in other Canadian provinces. So collectively, all four of these programs share in common that they're built on the latest evidence. They're facilitated by experts who have done this work and facilitated teams before, and are really highly interactive with the opportunity to network and interact with other primary care colleagues. So I'll do just a deeper dive into Patients Health Medical Home Expedition. So this is 12 half-day sessions over the course of a year. And the goal is to bring together team members that would represent various disciplines within a clinic into a collaborative learning environment. So collectively, those team members will learn about quality improvement in the family practice environment, have an opportunity to test and implement changes and measure the impact of those changes. I think this program is really geared towards teams that are looking to build a new collaborative practice, maybe teams that have been subjected to significant change, either personnel change, funding model change, change in service delivery expectations, and really need to learn how to adapt their team environment to those changes. I think it's also a great program for long-standing collaborative teams that just want to tune up their function and really re-energize as a practice group, and take their team functioning and their patient medical homeness, if you will, to the next level. The next slide shows the dates for the Expedition series. And we have two series, one that will begin in November 2023, and then one will begin in February of 2024. You can see there's a good period of time between each learning session, and during that time, teams will have a chance to do some work internally, test some changes, and then have a mentorship call with the faculty delivering the program between sessions. Things that we'll cover in the Expedition series include everything you'll see on the compass here. And I won't go into everything in detail, but you'll see these topics well reflected in the various documents and the evidence behind Patients Medical Home. And we'll cover things like building a culture of quality improvement, knowing your patient panel, improvements in access and continuity, improvements in clinic efficiency and flow, and proactive panel management as some sample areas. As mentioned, I think it's really important that teams have the opportunity to select what matters the most to them, what they most like to improve. And there's going to be variation between the clinics and what they choose to work on and tackle throughout the period of this collaborative. And Health Innovation Group's goal is really to support the changes that are identified by those practice groups, as well as kind of facilitate sharing and learning between the groups throughout the duration of the collaborative. Next is the Teams and Teamwork learning series, and I'll focus just for a few minutes on this learning series in a little more detail. And so teamwork, we know, is a core value in primary healthcare. And many jurisdictions, as I look throughout Canada, are looking to build on team support and team function in primary healthcare. And working together effectively as a team is probably one of the most impactful things you can do to improve things like access, continuity, as well as health outcomes for your patients. But I think even more importantly is the evidence that a highly functional team helps provider experience and team experience as well. This is 8 half-day sessions, and we'll lead teams through things like the science and foundations for highly effective teams, how to design an interprofessional team, elements that advance team effectiveness, team-based person-centered interactions, and really sustaining team function into the future. And so these are the dates for the 2 series that will be offered nationally, one starting in October 2023, and then the next starting in January of 2024. I just want to highlight before I turn it over to Arvel, the science basis for the Teams and Teamwork Learning series. It is based off the work of Eduardo Salas, and some of you may know Eduardo. He is a team scientist, one of the leading experts in team function, has worked in healthcare as well as other settings like NASA or air traffic control. He's had a really fascinating career, and we've had the opportunity to work in various capacities with Eduardo over the past 7 years. And some of us have delivered content with Eduardo on teams and teamwork internationally. And Eduardo's work is built on the 7 C's that you'll see here: capability, cooperation, coordination, communication, cognition, coaching, and conditions. And so what you'll experience in the Teams and Teamwork series is a deeper dive into tools you can use to improve team function, but also specific tactics and changes that you can make within your clinic to improve your team performance and function. And with that, I'm going to pass it over to Arvel to talk about the next 2 programs in a little more detail.
Great. Thank you, Brad. And so great to see everyone. I'd like to dive a little bit deeper into the practice facilitator training program. And so this international program will be led by experienced faculty, and they'll be delivering that evidence-based content to build practice facilitation skills in those in 8 half-day sessions. So the action periods occur between each session, and during the action periods, the course participants select areas of focus, including working with their practice teams to implement some of the change elements. So participants in the practice facilitation training program are going to learn strategies to engage teams, to identify priorities, and then implement those high impact changes. So the evidence is clear, as Eileen had highlighted earlier, that teams are 3 times more successful with that practice facilitation support. And so we're fortunate that the Canadian Nurses Association has recently certified the HIA's practice facilitation international program for 28 group learning credits. You'll see on the next slide, we have the dates for the practice facilitation starting in October for the first series, and then the second series will start in January. So following the completion of the course, participants will have the opportunity to participate in the international network of practice facilitators. So not only joining those Canadian practice facilitators together, but with other international practice facilitators. And there's many of them in the US and UK and other jurisdictions. And in this format, we'll be able to pose common issues and share ideas across the nation. The network is going to launch in 2023, and we'll be looking forward to attaching more information through the program as it emerges. What I'd like to highlight next is that the practice facilitation program is grounded in the concepts that are outlined in the College of Family Physicians of Canada Primer and Advocacy Guide. We had the opportunity to work together with the college and other members across Canada and internationally to produce this guide. And that's what guides this national facilitation approach. Each of these areas, these competencies or learning domains have been fleshed out, and the training will actually focus in moving the practice facilitators through strengthening their quality improvement skills, strengthening their work as a facilitator, of course, understanding the context in which they operate. As I've previously mentioned, addressing those evidence-based high-impact changes that will make a big difference in primary care practices. Of course, bringing together how data and information will inform decision-making, and then connecting with their local champions and leaders to propel their work in supporting practice change. The next program that I would like to highlight is the Person-Centered Interaction Learning Series. And this is a virtual program delivered over 5 2.5-hour sessions. It strengthens those practical skills and builds provider confidence in, as Brad mentioned, the person-centered care that is culturally appropriate and trauma-informed. In this program, facilitators use scenario-based learning, mentorship, and role-playing to provide exposure to a variety of patient and client examples and case studies. A unique feature of this program is that it'll broaden participation beyond the primary care practice and those in health to actually invite in community partners, groups like immigrant serving organizations, societies engaged in addressing determinants of health, and food security would be an example. And so participants will learn shoulder to shoulder with these other providers within the system with the goal of strengthening equity across service delivery areas. The dates of the program are highlighted here. These are starting in January. We think there's something special about this program, and that is that we've actually taken the time within Health Innovation Group to expand the person-centered framework to include not only how we interact with individuals in a person-centered way, but to really look at their care preferences, including as we've identified cultural safety and trauma-informed care, to propose an expanded person-centered care framework, and that will guide the training series for participants. I'm going to hand it back to you, Eileen, and because we wanted to share a little bit about us as Health Innovation Group and Health Innovation Action.
Yes, we do want to do a little bit of an introduction to you around why we are the right people to be supporting this work and accelerating some change in partnership with others who are doing such great work in the system. So Health Innovation Group and Health Innovation Action are really so well situated right now with experience in applying these successful methods across various jurisdictions. And so understanding how to apply the principles in an adaptive context-specific way. We have been very pleased that we've been able to work with international leaders and the best of the best and receive mentorship along that innovation path over the last couple of decades. We want to introduce you to the Health Innovation Group team. And so Arvel, as an award-winning nurse leader who has led innovation nationally and internationally, and is a subject matter expert on teams and teamwork and passionate about supporting people along that journey. Myself, as someone who has worked in multiple jurisdictions at the practice level, all the way through to being Vice President of Quality Improvement for Health Quality Ontario and many things in between. And Mark Watt, who is a master of quality improvement and data and informed decision-making, and Alexandra Salakine, who is an expert at international health system practice and policy and tremendous contributor. Kevin Bader, who is a subject matter expert in lean and flow and improvement with broad experience across health and industry for system flow, and Shaylin Garner, who is leading with expertise curriculum design that is adult-centric and interactive for all of our events and supporting quality improvement teams on their journey. We are so lucky to have a physician team, including Dr. Brad Baylor, with multiple experience in system design and redesign across several jurisdictions, and Dr. Neb Kovacina, who is a national quality improvement expert, who is located, who works out of McGill University and is a practicing physician in Montreal as well. Dr. Esther Tailfeathers, who also a practicing physician and brings expertise and passion in serving multiple and diverse communities with a special focus on building Indigenous community supports and capacity. And Dr. Tobias Gelber, who's worked under several payment models as well. So this is the Health Innovation Group team. And each has the expertise, and together, though, we have contributed to significant advancement across the system including being leaders in the production of the case for practice facilitation within primary care. So that primer for an advocacy guide for practice facilitation that happened through the College of Family Physicians of Canada. Also recognized in the new very important field of interprofessional teams. And so looking at teams and teamwork in a way that really honors the journey and the contributions of each team member for better care. Patient's health / medical home. So we have expertise in helping to build capacity and get results related to access, panel and continuity, efficiency and flow, patient-centered, culturally appropriate care, of course, patient self-management and panel management, including care planning and community engagement and social determinants focus. So all of those elements coming together. And just for the quality improvement collaboratives, so there are various methods to support this work, and this is just one, but we have served many thousands of teams together in being successful at testing and implementing this work in multiple jurisdictions across North America. We know that it's never about one person, it's about listening to others, and it's about the collective of people who are contributing to the work. And so because we have been at the leading edge of innovation in this area, then we have connected with global leaders in this area as well, who, because of their shared passion, want to support those who are doing this work. So you can see the names here of some of those that have produced the seminal documents that guide this work. So Dr. Mark Murray, Barb Bouchon, Dr. Mike Davies, Helen Bevins, Zoltana Kaldi, Claire Betker. These and many others are names of the network who are committed to joining us on a regular basis with the groups that we work with and building a social movement, contributing to a social movement around this care. So we also have experience that we can point to across Canada with specific projects and results. And so just the proof of concept, if you will, that has been applied in every jurisdiction, both in English and in French, as well as through national organizations delivering health services. And so really can understand in any business model, with any team composition, serving any population, how to support the progress of the teams that are doing this important work for the populations that they serve. We do have some examples of some of the initiatives that we're so very proud of having supported and achieved. And so here are just a few images. Some of them will be familiar to some of you, and you'll see some familiar logos. But what we see as well is the diversity of the work that we've done. So each of these has a story, and it's a story of partnership and collaboration with other health organizations, and it is their success that we are just so proud of having contributed to. So with that, I'd like to turn it over to Arvel to introduce the Health Innovation Action Board of Directors.
Thanks, Eileen. As Eileen mentioned, that Health Innovation Action is a national not-for-profit organization and really focused on getting this information, these types of programs to those who don't normally have organizational supports in order to access them, and also those health equity from a much broader lens as well. So I'm so pleased to be introducing Dr. Rob Waddell as Eileen, your early mentor and mentors to many of us, as an award-winning rural family physician and past president of the College of Family Physicians of Canada and former chair, of course, of the Chinook Primary Care Network and other CFPC committees on the implementation of the medical home across Canada. Dr. Alan Bailey is a family physician and clinical professor and member of several primary care research and strategic committees, And then Yvette Penman is HIA's senior advisor and comes with, many of you know her, comes with a wealth of experience in primary healthcare, quality improvement, healthy public policy and population health. And Yvette is leading Health Innovation Action as a delivery arm for these some of these programs. I want to next focus our attention on costs and funding supports. And so there is a cost associated with participation in these programs. And the cost listed for Patients Health Medical Home Expedition is actually a team cost to join in the year-long collaborative. And then you'll see the costs listed for practice facilitation and individual participant costs, teams and teamwork, as well as person-centered interaction series. It's really important to us that we are working hard to be aware of subsidies and individual supports that are available to organizations to be able to participate in these programs and cost not be a barrier. So part of our goal is to work with organizations who are interested in participating, provide you with this broader set of information to be able to offset costs related to any of the training programs.
Check out the links in the description to learn more and to register for our programs, as well as to connect with us to discover how we can support you and your organization's needs.